Hello, everyone. Can you all see me behind here? Am I for sure? I get really nervous right when I start. My hands start getting sweaty. I think I said this last year as well, so bear with me. But then we'll have fun. It'll be fine. So as Ajin gracefully introduced me, my name is Susan. I currently serve as the Secretary of the Department of Counseling Services within our diocese. That's a mouthful of basically saying it's a ministry that's working to destigmatize addressing mental health within our community. What we hope to do, or how we hope to do that, is by just starting conversations within parish settings. Oftentimes we don't say certain words that we are well familiar that this community struggles with. We just don't talk about it, let alone talk about it within a faith-based community. So we hope to continue to push the boundaries a little bit so that we can have these discussions, so that people can get the help that they need, so that we don't associate the stigma with the church. So sometimes the culture may have the stigma, and because we're an immigrant-based community, that stigma may translate into a misplaced belief that the church doesn't care about addressing mental health. Does that make sense? Kind of? Yeah. So in my own professional life, I am a licensed clinical social worker. I got my master's in social work and with a mental health concentration. I've been working at the Department of Veteran Affairs. My population is with veterans, but I do have experience working with women in residential facilities for eating disorders as well. I started off providing individual and group therapy for folks that were looking to make changes in their substance use, so alcohol or other substances. I currently work in suicide prevention, which is a role. I basically work with veterans that struggle with thoughts of suicide that may be admitted to an inpatient facility as a result of a suicide attempt, but I also provide consultation to providers who have patients that struggle with thoughts of suicide. No 2 days are exactly alike. It keeps me on my toes. But it's also, when I tell people that that's the job that I do, it's usually a conversation stopper. So it's a very interesting job. And I think a lot of my experiences, what I notice is, in my experience, I oftentimes think about how that experience can translate into our setting. I want to do something a little bit differently. How many folks here has heard one of the mental health counseling sessions before, whether it's at Focus or in your own parish settings? That's pretty cool. So a pretty good number in this room. So I'm not going to do the same thing that we did a couple years ago at Focus Nation. A couple years ago at Focus Nation, we talked a lot about the importance of awareness, but I get the sense that in this audience, we all understand that this is an important topic to discuss. And I see a lot of heads nodding, so I'm just going to take that as an affirmation of that statement. I want to shift the focus a little bit here today, and I'm going to start off with a question. And I want this to be very dynamic because I don't have a PowerPoint, and I have an idea as to how this should go or could go. But I'm going to ask the question: if someone were to approach you individually and ask you to consider starting therapy, what would your reaction be? Great. Okay, so I heard maybe get defensive. I heard for what? Okay. What else?
Do it.
What's wrong with me? Okay.
How much is it?
Can you pay
How much
for
is
it?
it? That's very fair.
Same thing.
Well,
Same thing. Can you pay for it?
can you pay for it? Yeah.
Like, do you know how to find the right person?
Okay. So, like, how do I go about seeing somebody?
Are they faith-based? Are they?
Okay. So, what do I need to what do I need to look for if I'm trying to find somebody? Yeah. Okay. What else? If somebody came up to you and said, "Hey, have you considered talking to a therapist?" What other thoughts would go through your mind?
Will it work?
Will it work? Yeah.
Depends on who's asking.
Okay. Why?
Because if the person knows you or not, or if you're in control.
Yeah. So can you trust them?
Yeah.
Do they know? Are they making a suggestion or a recommendation with intent that I can trust.
Right.
What else?
Why do you think I need to go?
Why do you think I need to go? Okay. So I heard a couple of those responses, like why, right? So let's say, hypothetically speaking, the response to that would be, hey, I've noticed things have been off with you lately. You don't very much so seem like yourself. I think you ought to talk to somebody about it. What would the reaction be at that point?
I'm fine.
What was that?
I'm fine.
I'm fine. Okay. What else? I'm not ready. Is that what someone said?
Yeah.
I'm not ready. It's not time. Yeah.
Get defensive.
Get defensive. What would that defensiveness look like? Like a ha! Like, who do you think you are? Okay. Maybe you should go. Yeah. Have you thought about it? Okay. What do you all notice about these reactions? What's the general, very vague, because we got a spectrum of responses, but what do you notice about the responses that you heard?
Negative.
All negative. What was that?
Is it like lack self-reflection?
Yeah, lack self-reflection. Like I'm not paying attention to what's going on inside right now. Yeah. Say more about that all negative. What is it? What did you all hear?
It's dismissive of maybe the issue that you actually have.
Yeah, it's dismissive. It's not what I'm addressing. I'm not responding to it, right? These are barriers, right? These are all the reasons why people don't seek mental health care and more. We oftentimes talk about, I think especially in the conversations we've had in the last couple of years, we've talked a lot about, hey, we all know somebody that struggled with mental health issues. How do I support my loved ones, right? And that's oftentimes what we want to be able to do. We want to be able to provide support for our loved ones. But very rarely do we think about when is it appropriate for me myself to receive mental health care. The dangers in thinking about it's meant for somebody else is that we believe that it's not for us, right? So I'm going to ask a follow-up question to that. When would you all feel as though it's an appropriate time to seek mental health care?
When it starts affects your daily living.
Okay, when it starts to impact your daily living, what would that look like? What does that mean?
I guess if you can't do your typical day and you're not able to go to work anymore, you're not able, or it messes with your abilities to go to work, go to school.
Okay, so if it distracts me in such a way where it impedes my daily functioning, I can't function at work, maybe it's difficult for me to concentrate while I'm driving. What else? How else would I know?
If you're isolating yourself.
If I'm isolating myself. So how would I know if I'm isolating myself?
You're a social person. Be alone.
I want to be alone. I don't show up to things. People are probably calling me, texting me, and I'm not really answering, right? Okay. What else? How else would you know it's time to, maybe not time, but maybe I would benefit from seeing somebody, talking to somebody.
And over anxious, having emotional instability.
Okay. Maybe I'm feeling anxious, feeling some level of instability.
More than a feel of your loved one's going to tell you.
Yeah, if your loved ones say something or express some sort of concern, someone that I respect, someone that I can trust, yeah.
I feel like
Thoughts of dread, like I don't want to wake up in the morning, I don't want to go to work, I don't want to go to school, I don't want to see so-and-so. There's a...
Yeah, I feel like if it's something that's, you feel like there's a weight on your heart, there's something on your heart that really kind of compels you, or you've been thinking about should I go talk to somebody?
So maybe if you feel this heaviness that you just can't, it's a weight that you can't lift off, maybe it needs to be expressed.
if you experience something traumatic.
Yeah, if you experience something traumatic, right? I often say that I believe that everyone should go to therapy at some point in their lifetime. I think a lot of times we believe that therapy is reserved just for severe mental health issues. I think a lot of times people assume that a space to talk and process thoughts and reflect on certain beliefs that we hold about ourselves is reserved for folks that present themselves in a certain way that limits their functioning. But when do we often feel isolated? In what sort of situations may we isolate? In what sort of situations may we have a disruption in our daily life? When does that happen? Or let me ask this, has anyone experienced any of that before? Yeah, when does that usually happen? Okay, could be when I'm depressed. But when does that interruption of daily functioning occur? During times of change. Difficult change, right? It could be a transition to a new place. It could be a loss of a loved one. It could be any sort of change that may require added attention to that phase, right? To that change. I also want to make a very quick comment before I want to keep an eye on the time. What time is it? Okay. It's important to mention that a mental health provider is not the same as a spiritual father, and a spiritual father is not the same as a mental health provider. Those two serve very different functions. The end goal is very different. Does that make sense? So a spiritual father is not meant to replace a mental health provider, and a mental health provider is not meant to replace a spiritual father. Mental health care attention can be necessary, or is always necessary, in your spiritual journey. Right? Paying attention to how I feel, what my emotions are, what my thoughts are necessary in our spiritual journey. Right? So in the same way, we must take care of our bodies as a way to take care of our souls, as a way to take care of our salvation. The same is true for our own mental health care as well. I want to talk a little bit about the specifics. That's my goal for today. So those are kind of abstract questions and all, but I want to talk a little bit about specifics. Who are providers? How do you seek care? What are the different levels of care? How do you pay for care? That's a very important question. I know that there are folks in the audience that are mental health providers. Can you raise your hand if you are a mental health provider, or you are in school, or you've been trained? Just go ahead and raise your hand. So there's a handful. There's about 3 or 4 here, and not to mention a couple of clergy as well. I also know that there are folks in the audience that have gone through therapy before in your own life, whether you're currently in therapy or you have historically. I encourage you, if you feel comfortable enough, to share your own experience as we talk, but not just for the sake of disclosing, but to provide some additional information to the whatever is being talked about. And I also know that there are folks in the audience that are probably contemplating going into therapy. And so if those folks have questions, if you don't feel comfortable asking them, feel free to ask somebody else to ask those questions for you. All right? So before we start, or actually we've started for the last 20 minutes. So who are the different mental health providers? Clinical psychologist. Okay, so what's a clinical psychologist? What do they do?
Behavior.
Okay, so they address behavior. Mm-hmm.
They're like psychiatrists without behavior prescriptions, right?
Mm-hmm. So we have folks that can prescribe medications. So who are the ones that can prescribe medications? Psychiatrists. There are also nurse practitioners that can prescribe medications. Psychiatrists can also do talk therapy. So some psychiatrists you might see in outpatient care that can also provide therapy. But the primary function of a psychiatrist is someone that's been to med school and have residency in a psychiatry setting. Okay, so they could prescribe medications. Nurse practitioners are very similar. Psychologists. So psychologists are folks that have a PhD or a PsyD, so that's a Doctor of Philosophy in Psychology, that's a PhD, or a PsyD, a Doctorate in Psychology. Both of them have doctoral experience in providing therapy. A PhD psychologist does research or has done research. A PsyD has done clinical work, extra clinical work. But both of them, both a PhD and a PsyD, are referred to as psychologists, and they provide treatment. They provide individual treatment, they do assessments, and they do clinical testing, all right? We also have master's level providers as well. Have you all heard of different types of master's level mental health providers? So this is where it kind of can get a little confusing because people use terms interchangeably, but these are the folks that you might refer to as counselors or master's level therapists. They could be masters of arts in psychology, it could be an MS, it could be an MSW, so a social worker as well, but not all social workers provide mental health care. All folks that have a master's in counseling oftentimes do provide mental health care. Social workers, actually only social workers that are specialized in mental health can provide mental health care or have the experience of providing mental health individual and group care. All right, does that make sense? The different types of mental health. For those of you that are in the field, would you add anything else in terms of the different types of providers or things that people should know?
Marriage and family therapist?
Yes, LMFTs. So licensed marriage and family therapists, or LMFTs, are folks that are very much so trained specifically in addressing the family dynamic. So a lot of times if you go to couples therapy, you would see somebody that has a license in family marriage therapy. School psychologists, school social workers. So in school settings, grade school, high school, middle school, you'll have a social worker or a psychologist. Their responsibility is to provide individual or group therapy for adolescents, and oftentimes even do testing as well. Anything else? Art therapist. So art therapy addresses, has anyone heard of art therapist before? Okay. So art therapy is a therapist that's specialized in processing emotions and experiences through art. And that can be through actual paintings, it could also be through dance and movement, music as well. A lot of times you'll see art therapists housed within almost a larger mental health system. So like residential care or so. Any questions about different types of mental health providers? Okay. Different levels of care. Have you all heard of levels of care before? Okay, so you have outpatient care, inpatient care, residential care. What do you all know about therapy settings? If you were looking for somebody else, or if you for yourself is looking for a therapist, I guess where would you go? Quite physically, where would you go? Yes. So most of the times when we're trying to see somebody, we want an assessment, we would go to an outpatient setting, very similar to a specialist in our medical, addressing our own physical health care. We would likely go to the hospital where they have outpatient appointments or settings. A lot of psychiatrists, a lot of psychologists work in an outpatient setting, which basically means you may be asked to go see somebody once a week, once a month, depending on what your needs are. We have another level of care if the provider feels as though you need a higher level of care. There's something called an intensive outpatient care, which you go more frequently. Partial hospitalization program, you go even more frequently. And then you have residential programming. Residential programming is where you are housed somewhere for about 3 to 6 weeks or so, depending on what's recommended. And then inpatient acute care. Does anyone know what the difference between inpatient and residential care is? Inpatient acute care. Yeah, so inpatient will always be in the hospital. This is when oftentimes people are at a point where they can't take care of themselves or are at a risk to themselves or others. They need immediate stabilization, and so that's the function of an inpatient hospitalization. Okay. So then the big question is, if I need therapy or if somebody else needs therapy, where do I go or how do I start the process? So what has been your experience in that? How do you find a therapist? Google? It's actually where I would start.
Insurance provider.
Insurance providers, yes. So all insurance companies, since the Affordable Care Act came out, are required to cover mental health in some capacity. So if you go onto your insurance company's website, say find a provider, go through your specialties, you put in your zip code, and a list of providers will come out, at which point you can go ahead and Google those providers to see if there are reviews online. I'd also encourage calling them. If you call them, you can ask them specific questions like what is your specialty, what's your level of experience, do you have comfortability working with minorities or whatever sort of issues that we might be concerned with. If you're working with a spiritual father, this is a process that you can work alongside with your spiritual father. If you'd like to incorporate somebody into your own care, you can sign a release of information and they can be a part of those sessions to whatever capacity you would like for them to be involved. Primary care physicians. Everyone has a doctor. Go to your doctor. Let them know what's going on. They're required to do screenings every year or so or every visit. They do the depression and anxiety screening. You answer them, and you can express your concerns and say, hey, I'd like to see a therapist, and then they will go ahead and send a referral. And then they can give you a list of providers as well. What sort of barriers, I think cost came up in the very beginning. What is everybody's understanding of how to cover costs in the mental health, in accessing mental health care? What was that? Okay, so insurance covers for some. Mm-hmm.
A lot of employers have benefits too.
Yes, yeah. So has anyone heard of EAP services, the Employee Assistance Program? So most employers have a benefit program where you can seek therapy, short-term therapy through your employer. It's confidential. Usually companies contract out unless it's a hospital setting. Sometimes they employ their own providers. But you can go see somebody for a short-term period of time if it is an issue that is causing some sort of disruption in your own work life or even in your personal life. Sometimes they even cover benefits for your family members as well. And then they can provide resources for extended referrals if the process needs to continue.
Sliding scales.
Sliding scales. What are sliding scales?
So different places will have like a different scale of pricing.
Mm-hmm.
So depending on what you're able to afford, you're not always required to give a certain amount. They have like a scale.
So it's sort of income based.
Yeah.
Based on what you can afford, you can go ahead and pay that up as well. So when you call these folks, you can ask them if they offer sliding scale. And a lot of times it's quite negotiable, to be honest. So I wanted to kind of put all of that information out there because I think those are the questions that pop up at the end of these open sort of discussions. What time are we at right now? Okay, so we have 15 minutes. 2:15. Okay. So that's the sort of information, all of that information is what I had prepared to offer you all beforehand because these are the questions that are frequently asked. But I also know that the audience oftentimes have a lot of other questions within the field about how to access care. So I'm just going to open it up to you all right now. What questions might you have?
Can you touch on, like if someone within our church is experiencing like I don't know, depression, anxiety, something like that, what's our approach on how, I guess, to approach that situation?
Okay, so the question was, if somebody in our parish setting struggles with depression or anxiety, what should be our approach, or what's the recommended approach? So I'm going to toss this back to the audience. What do you all think?
Maybe have them talk to their spiritual father or the action.
Okay, so encourage them to talk to their spiritual fathers.
But if not, then maybe go see, tell them this is therapy.
Okay, so maybe encourage therapy as well. Okay. What is our role in our community? Is that Angels?
Oh, y'all can answer that.
Thank you.
Anyone can answer whatever questions you want.
Just be present, be engaged with whatever they choose to share or not share.
Yeah, I think, so you had said being present, and Amy George had said in the last session just to be with them. through their discomfort. And I think a lot of times we look for words to say, advice to give. I often say that the best therapists are ones that don't give advice. Best therapists are the ones, quality therapists are the ones that are able to be with you in the self-exploration and help them discover their own reality. And then have that person decide where they want to go. So it's not about talking to someone, it's not about taking control over another person's life. It's about providing a space for people to sit in their reality, as uncomfortable as it might be. Because no one wants to feel alone and isolated. No one wants to feel anxious. It's a very uncomfortable feeling, right? And it's a very lonely feeling. And so to be able to sit with somebody, to willingly feel that uncomfortable feeling with somebody as they're going through it, speaks far more than words. So I would say sitting with somebody in that discomfort is probably our responsibility as someone that just cares about the person next to us.
What if they don't want you to sit with them?
So the question was, what if they don't want you to sit with them? So what would that look like though? So you know somebody is struggling with depression, anxiety, or some sort of distress, and they just don't want your help. Is that the question?
Yeah, they're not open to it, or
They just
they're
want
not
to be alone.
perceptive.
They just want to be alone.
They just want to be alone.
They just want to be left alone.
I'm fine, or you know, or they're aware maybe and not saying, not admitting that they have an issue, but not also
Sure.
admitting that they're fine.
That maybe they don't see it themselves, or maybe they're not at a place where they're
Or
wanting
they
to
see
have
it
that.
but don't want. I can deal with it.
Sure. Yeah. What do you all think?
It's always good to offer resources. Like, you can't make someone do anything, but I think like sharing our experiences, especially like if we've suffered with something the same, or just offering the resource, like, hey, I've tried therapy, or like this is what's worked for me. Like, I
Being
feel like
able to provide, being available to provide those resources if that's something that they want.
Right.
Being available to share your own experiences if that's what they want to hear. Sometimes it might just mean respecting where they're at. They don't want to hear from us. That might just mean we take a step back, but still be present in different ways that they're willing to experience us. So that when they are ready, then we can be there with those resources, with that support, with that experience.
So like in nursing we're taught, you know, like if someone's not being responsive to you, you just like sit there and let them know that you're there for them, and you give it 5 minutes, 10 minutes, and if they're still not open to talking, then at that point is when you say, you know, like I just want you to know that I'm here for you, and whenever you're ready to talk, I'll be here.
Whatever we can do to remind folk here when they need us, whatever that might look like. That might just mean, hey, I'll continue to play, you know, I'll continue to come over and, I don't know, do whatever we normally do and we don't have to talk about this, but know that I'm not going away. Right?
So I know the answer, but I don't know like how to properly say it, but a question or in response when those suggestions come up is always, well, like the person saying, I don't believe this is a physical or mental issue, this is a spiritual issue, right? And it's just a sign of your walk with God, and you just head down, go through it, go to your Achin or whoever, your spiritual mentor, right? And that's how you deal with it, right? Like this isn't a mental health issue.
I see. So the question is, correct me if I'm misspeaking here. It sounds like the question is, what do you do when a message is delivered?
Well, like what is the response?
What do you,
like
so
how do you
respond to people, perhaps in our own communities, that invalidate the mental health realities of somebody and just chalk it up to saying...
Or like what, or could you explain like what is the line between your spiritual and the mental health? And,
yeah. So what is the line? Actually, I just asked Abby George this question during lunch. What is the line really between what is the difference between addressing mental health care and your spiritual care, and how intertwined are they? And in many ways they are intertwined, right? Because taking care of ourselves is a part of our own journey, our spiritual journey. If spiritual journey means full and complete healing, that involves all parts of who we are, right? We wouldn't necessarily tell somebody that's been diagnosed with, I don't know, asthma, not to take their inhaler, right? Or not to see a specialist, or not to take precaution during allergy season. That's quite contradictory to our spiritual well-being, actually, right? It's the same, I would say it's the same sort of reality. There is a book, I wrote down the quote because I wasn't sure if it would come up, but there's a book written by Father Alexis Trader, and the book is titled Ancient Christian Wisdom and Aaron Beck's Cognitive Therapy book, or Therapy, that's the name of the book. But there's a quote in there that says, "Thus, even as psychology offers a descriptive account of how fallen man functions, thinks, and behaves, so theology can provide prescriptive and normative advice for the life, thought, and behavior of the new man in Christ." So I'm going to repeat that one more time, because I know that was quite wordy. "Thus, even as psychology offers a descriptive account of how fallen man functions, thinks, and behaves, so theology can provide prescriptive and normative advice for the life, thought, and behavior of the new man in Christ." There's a role for both in the process of healing. What other questions do you all have?
You mentioned you work mostly with veterans, but I was just curious if you had any experience or if you have thoughts on how, like in our growing millennial generation, and even with us, how like social media plays a really big impact on our just.
Yeah, like how does social media play a role in our mental health well-being? I think the biggest issue with social media is that it distracts us from the present moment. We're not able to be present. It is quite literally a distraction from how I'm feeling. It can oftentimes be used as a tool to change how I'm feeling because I don't like how I'm feeling. Or it can create a new false reality, which is not a reality, just a falseness of what my life ought to be, right? It can exasperate a lot of things, but it doesn't mean that social media in itself is evil. It's just how we use it. It's how we use anything, really. How we use our friends, how we use our time, how we use our energy, how we use any sort of resources. I don't think it necessarily causes one thing, but it could lead to more distress and uncomfortable feelings.
I guess I'll speak on personal experience. For someone who, like maybe I feel afflicted by certain emotions, but I don't feel it strongly enough that it inhibits my behaviors or my decisions. You had said that like everyone potentially could be or could benefit from therapy, and we know that our purpose and like our journey requires us to be free from the suffering or from not much, just free. And so, what do you say to someone like me who may feel these things, but not feel them bad enough to feel like I'm
Sure. So a lot of times we think that mental health attention can only be addressed if I have a mental health diagnosis. First of all, no one can make a diagnosis besides mental health providers. So we can WebMD anything that we want, but there may be an underlying mental health diagnosis there that we're not fully aware of. And the only way that we can figure that out is by seeing a provider that does an assessment and gives us a diagnosis, right? Because that's what they're licensed to do. But we don't always go and see a doctor because I've had this cough for 12 months. Has anyone gone and seen a doctor when they're perfectly healthy? Yeah. Physicals, right? We kind of check up on ourselves, and maybe if it's not an annual physical, it's maybe something that I need to get done for school or so. And maybe in that conversation, topics come up like, hey, how are you sleeping? Right? Oh, I've noticed that you gained weight or you've lost weight. Or let me just check your labs, right? And hey, it seems like your cholesterol has changed since the last time you came in. I'm not necessarily going in because there was an identified issue. I'm not necessarily going in because I couldn't sleep for the past 2 weeks, right? But I might want to go in to get checked out, and maybe in the process of doing so, I may discover that there's something that's worth processing that maybe I haven't processed before. So yeah, I think there's a way to do that. It's a space. Therapy is a space to be able to talk about things, to process things that otherwise I would control how I process.
Along those same lines, how do we use spiritual therapy on a daily basis, like preventative mental health, or just in dealing with our lives? Everyone here experiences anxiety. Everyone experiences stress. Everyone has, multiple kids or family issues.
How do we take care of ourselves?
How do you take care of yourself, just like we do with our own self? We apply our own Band-Aids.
Right. We go on walks. We go, make sure we get 8 hours of sleep.
Yeah,
Drink
exactly.
8 cups of water.
All that stuff.
Yeah. Telling myself to do all these things. Yeah, so that looks different for different people, right? I think for some people that might mean journaling, some people that might mean taking deep breaths. I know a lot of like phones and stuff have those like deep breath reminders or so, or there are apps that remind you to drink water, right? There are apps that can guide us through just closing your eyes and focusing on our breath.
So there are like spiritual tools that we can do, right? So
I think,
you're talking about reflecting. So
yeah.
You're writing in a journal, you're reflecting on it and praying on it.
Sure.
That's a therapy in itself.
Yeah. I wouldn't call it therapy. I would call it therapeutic.
Yeah.
I think it's a therapeutic practice to be able to reflect and process some of those things. And quite honestly, that's something that looks different for so many different people. I've been journaling since I was in the 2nd grade, and I've got maybe 20 journals in it's ridiculous. Because nobody wants to hear me. Like Shandy gets really tired of me talking all the time, so I'll just keep journaling and I'll keep writing. But then once I've written it, it's just for that moment at least, whatever was going to remind is on paper and I can put it away, right? That's something that works for me, but not everybody, maybe that's not where people are at. And so for some other people, it may just mean, putting a timer for 5 minutes and stepping away, going outside, or focusing on a certain sound or so. But those are things that you can go online and quite literally Google and type in like coping skills or mental health activities or so, and then you'll just see like hundreds and hundreds of different types of coping skills that pop up. Right?
So I was going to say, going to that, like I think touching on what you and Ebietchen said, the importance I think is also having like a regular spiritual father and a regular counselor. So I'll just share my experience because I don't mind sharing. So I've been I've seen a counselor consistently for the last 5 years, but and I've seen the same one for the last 2 years. So she knows my personality and my ins and outs and like things that bother me. And even in good times and bad, it's like they understand how you process, So when even if it's not a terrible situation, if you're struggling